talking about serious stuff and diminished responsibilities and still the consequence of COVID making things worse, not better. Day beforehand, no, yesterday afternoon, Auditor General John Ryan brought a report to Parliament and looking at the state of the New Zealand health system. And the state of that report was such as to, frankly, I wouldn't say it sent shockwaves because it's well known, the conclusions that he reached, but it manifestly or shows the manifest failure of health system in this country to deliver, despite knowing that they've had a problem, oh God, no, not for years, but for decades, to do with the availability of healthcare in this country and what is known as the postcode lottery. Now, the postcode lottery in other countries tends to mean usually that, and it's specifically usually grouped around socio-economic disadvantage. But in New Zealand, our postcode lottery is slightly different in the fact that if you live in certain parts of the country, you get access to healthcare really quickly, on time, pretty efficiently, and pretty effectively as well. But if you live in other parts of this country, good luck. And as part of that report yesterday, Auditor General John Ryan noted that when it comes to elective surgery or planned surgery in this country in particular, it is not equitable or timely. His words, not mine. And he used cataract as a really good example, that someone could go blind in Southland but have their sight restored or repaired in Auckland, and yet living in the same country, same problem, but because you're living in Southland, and listen, everybody in Southland knows this, your healthcare is so much worse. We're not just talking, though, about cataracts, pardon me, we're talking about orthopedics, ears, nose and throats, cardiology, and a range of other elective surgery and operations and procedures in which large numbers of New Zealanders are discriminated against every day, week and month by the purpose of their geography. Joining us to talk about that and her response to the report in general is Dr. Samantha Murton, the President of the Royal College of General Practitioners. Dr. Murton, lovely to have you on. Welcome to the show. Hello.
Hello. Yes, I'm here. Yep.
Good on you.
Yeah.
You heard my introduction, your reaction to the report yesterday.
It's stuff that we already know, and we have, I suppose, from a general practice perspective, we hoped that the changes to Health New Zealand would change that up, and that was part of the reasons for making the changes. But we still have not seen a shift or any significant shift in the postcode lottery that we deal with every day.
Okay. So you're saying that really you've known about it, I'm sure you have, you've been prescribing. Where do you practice from? What part of the country?
Well, actually, I practice in the middle of Wellington, but I have a high needs population that we look after. I try and get them through surgery in Wellington, and I know that even in Wellington it's different from other places. And I have people who live in Hawke's, in the Hut or the Wairarapa or up in Otaki, and their access to care can be different from the people who are living in the middle of town.
It's absurd though, isn't it? How has this been allowed to develop? I mean, this is ridiculous. We've got a New Zealand health system. How has it got so bad over such a period of time and seemingly becoming more intractable, not less?
I think there's a multitude of reasons why. I think source of numbers always allows cost-effective care. So when you think about Auckland, a quarter of the population lives in a very small region. You can provide services. There's no travel involved. There is a large volume of service that can be provided, so therefore you can have the adequate numbers of service providers, so surgeons and anaesthetists and all the rest that you need. When you end up in an area like Southland, you've got a population that's spread broadly. You've got the volumes aren't as high. Having the numbers of staff is harder because they don't have that same sort of volume coming through all the time. And who's going to travel? Is it the patient who travels who maybe can't afford it, or is it the surgeons and the services that travel? So it's we're talking about the cataract thing just yesterday, about the fact that it costs more money to get the levels lower for someone to get their cataract surgery before they go blind in Auckland. And that money put into that is, there is money that needs to go into it. But then you sort of go, well, actually, why are we then not doing that same thing for the other 75% of the population across the country? It is harder, it will cost more, but you shouldn't have to be blind before you get cataract surgery because of where you live.
That's correct. But it's not
Yeah.
just cataract surgery, it's cardiac. There's a whole series of other procedures that are denied people simply because of where they live. I live in one of the worst affected areas in New Zealand of Central Otago and Queenstown, which you expect, as a good example. But here's the issue. Is one of the issues here the selfishness of health professionals themselves and the aggregation into areas where they want to live and be rewarded, that they don't want to have to move from wherever they are. And frankly, the Hippocratic Oath was dropped out the window a long time ago.
I think many of the health professionals would challenge whether we do things selfishly. A lot of us are working really hard to get the best care for our patients. I think when you think about where are you going to learn, so your learning structures are actually quite difficult. And when we have most of our learning happens in hospitals and in hospitals that are tertiary centres, then your ability to actually consider going and living in a smaller town or a regional centre is a lot less. And also you're learning at a time when you are setting up your own home and family, etc., etc. So why would we be required to disrupt families more than any other person who's doing a job just because of what we chose to do? And I think it's a bit harsh saying that we are selfish about it. I think the other thing is that we're trying
Well, I'm
to
just
shift that
thinking, can I
learning
give
so
an
that-
example? The number of specialists who train in this country, go through med school, given, God, it costs hundreds of thousands of taxpayers' money to train them, and then decide to slope off overseas. I mean, that strikes me as being particularly ungrateful and certainly not particularly very altruistic. It might be aspirational in terms of the individual careers, but an awful lot of money's gone into pay and train those people, and for them not to stay resident in New Zealand for any period of time and to work in better paid jobs overseas exacerbate our health professional vacancy problems. Don't we need to address that as well?
Well, I think we can, but we've got a cousin right next door who, in many of the colleges that we train in are Australasian. Some aren't, but some of them are Australasian. And if your cousin next door has vast sums of money and can pay, the terms and conditions are very different, and the same happens for nurses and various others who, if you are working super hard, and we do work really hard in a lot of areas and a lot of the regional areas with small numbers of people around us supporting the services, and the terms and conditions or the environment that we're in is not as good as it could be across the ditch where you could just go and work. Who chooses to do the hard yards constantly relentlessly without any hope of change, and says, well, I'm just going to make the sacrifice, because that's what it is. And I think we do need to think about how we can make it better for our colleagues and make it easier for us to stay and make the terms and conditions better for us to stay in our country. But we, as a government, we're competing hard with someone who has more money to throw around. I think the other thing is the experience of learning is of where you learn is a really important factor, and there's a lot of evidence overseas that if you spend time learning in a regional town or a smaller environment, you're way more likely to go there and stay. And as soon as you've planted your roots and are staying in that town, then that's where you will stay if you can possibly do that, as long as your work's not doing you head in. And if your work's doing you head in, anyone who's a worker would go like, I'm not doing this anymore.
Yesterday I had the chief economist of the ANZ Bank on, who talked about, ironically, a sort of version of the Great Replacement theory. She said that we're losing large numbers of well-trained New Zealanders overseas and they're not coming home, but then we're replacing that skill set with people who aren't as good, but we're having to bring them in from overseas to do those jobs. And I think she was thinking of medicine in particular, or as one of those particular issues. Is that your experience as well?
Yeah, and I think New Zealand has got the highest number of overseas trained people in the OECD working in health, and that shouldn't be happening. I think there's two things that we're working on. One of them is, increasing the domestic graduates, trying to improve the terms and conditions for the work, but also making it more attractive. But I think some of the skill sets that our clinicians need to provide the service for patients in New Zealand. So, say there's some very technical cardiology services, there's some very technical radiology services. Sometimes you need to go overseas to learn that bespoke skill and then come back. But we don't have a system of allowing people to come back easily. So we're working on the come back, welcome home easier for a lot of our overseas people who have gone and done a year or two, and someone says to them, oh, well, why don't you stay? You're really good. Whereas New Zealand's not saying to them, come on back. We would love to have you back, and here's the space for you. So we're working on the returnees as much as anything we can do. Yeah.